Good morning, everybody. My name's Katie. I'm our Vice President of Marketing. So pleased to be here with you all today. I have the pleasure of talking about market development, which I think is just so fun. What we're going to be looking at today, you've already been hearing about. We have an underpenetrated market and a market that's growing. We've talked already today about the more than 1 million patients who have epilepsy that's not responding to drugs. Yet not even 7,000 of those patients each year make it to a surgical consultation and receive a therapy other than the drugs that have already shown they're not working. So a real need for devices like the RNS therapy. Today, our target addressable market is in adult focal epilepsy. It's a significant opportunity, and we're going to talk a lot today about how we expand adoption in our core market. But we have the opportunity to move into generalized epilepsy as well as addressing the pediatric population. This is going to essentially double our addressable market. Really an exciting place to be. And we're on a journey through these market development efforts. This is not something we're starting today. For the last few years, we've been focused on the CEC. You've heard about that today. Those are the comprehensive epilepsy centers where most patients who end up with an RNS device are treated. We have some really great, strong clinical data that differentiates us from our competitors. You saw the post-approval study data earlier today. This is unique and unmatched in the space. We're also expanding in the community. You guys heard about the CARE program? We're going to talk more about that today too. More than 1,800 epileptologists are not in CECs. They're out in the communities, and they follow quite a few patients. So as we expand to build more implanting RNS centers in the community through our care center, it really opens the access to more patients. And then, of course, expanding indications continues to be a key strategic initiative for us. The Nautilus trial, we're really excited about the progress there, and that will open the door to generalized epilepsy, and also our efforts in the pediatric space make this a really fantastic opportunity for developing the market. Let's talk about each of those in a little bit more detail. First, our core, those patients who are at CECs, those physicians who are assessing patients at CECs and then implanting them. We will continue driving preference for RNS, driving awareness and adoption for the procedure. We're the only therapy that provides 82% seizure reduction at 3 years. We're the only therapy that improves cognitive function. Patients can remember better, they can learn better, they can speak better. And that results in an improved quality of life at just a year. Now, it's easy for me to put a bullet point up here on this slide about improvement in quality of life. But how about Mike's story earlier today, where we got to see how his life changed really significantly because of this therapy? He was able to get a job, pay his taxes, and now works educating patients about the benefits of RNS. It's super exciting. I wanted to talk a little bit about our direct-to-consumer strategy. I'm not sure how familiar you are with our pipeline, but we've built a really solid infrastructure for reaching patients directly. This starts with digital advertising. We use platforms like Meta to get patients' attention. They come to our website and take a quiz. And based on how they respond to that quiz, we understand, first of all, if they're a target customer for an RNS device, if they're drug resistant, over 18, and then we can triage kind of where they are in their journey. We pair them with a nurse navigator, and our nurse navigators do one-on-one education to teach the patients and their family about the device, but then they also help the patient maneuver through their medical community so that they can reach the physicians who can prescribe RNS. And for those patients who are a right fit for our technology, through coordination with our sales team, we help them interact with physicians, and then ultimately they're implanted with an RNS device. So An appreciable portion of our revenue this year in 2024 is tied to our DTC efforts, and we will continue to expand these. We're expanding our direct patient advertising. We're adding more nurse navigators. We're creating new educational content for this group, and we will continue introducing new programs. For example, we're doing new local programs where we partner with physicians so that they can educate their community of epilepsy patients about RNS. So it's really exciting to see the way we're growing here. Now, to date, we have really focused these DTC efforts on patients that are in a CEC already. They're the ones that will move fastest through this funnel. However, as we move forward, we're going to begin advertising to patients who are in the community around our new care centers so that we are really reaching more patients that we can funnel in through the care center. And I'll talk a little bit more about that in a moment. But first, I think it's important to recognize what we're doing with patient education. We're adding nurse navigators, but our 3 existing nurse navigators spoke with over 1,600 patients in the last year, providing that one-on-one education. And Mike often gets asked by physicians to do patient education. He alone spoke with over 500 patients this year, and more than 90% of them moved on and chose to get an RNS device. That's a very impactful part of our program. We do monthly virtual chats in the community so patients can interact with physicians and nurse navigators and Mike, ask questions, learn about the device. We also have a host of patient ambassadors that can speak directly to potential patients and their families, as well as help us with outreach in the community. Finally, of course, we have a full sales team that does education with reps and their families, patients and their families, as they're considering the device and then after they're implanted. So it's a key part of our strategy. Speaking of strategy, let's talk now a little bit more about our outreach in the community or the CARE program. And this again has been a significant program for us. Meaningful revenue in 2024 was generated from the CARE program. Now it's important to realize that it helps us today to expand into the community, but this is part of a broader strategy. As we move to getting the indication for generalized epilepsy, those patients have an easier, simpler workup. And so by activating more centers that can implant RNS today, we're really setting ourselves up to capitalize on that future indication. So within CARE, we're starting new centers, places that have a neurosurgeon that isn't affiliated with the CEC, that either have the equipment or are interested in acquiring the equipment so that they can perform implants in their center. This has been very effective. Another part of the CARE program is really establishing and confirming the referral pathways from the community into the care center. That means that we're spending time with neurologists, we're spending time with epilepsologists so that we can educate patients and flow them into the newly implanting care centers. Also, there are some times when the patients are more complex and they need to be worked up and treated at a CEC. So these referral pathways also work in that manner. So as we continue building on the success of the CARE program, what that looks like this year is we're increasing the number of targets that we have for those new implanting centers. We've created a raft of new marketing materials for our sales team to use with referral physicians in particular. And then we're adding digital marketing so that we can identify and educate those patients that are in the community to fill the funnel for those new implanting centers. And then finally, we're adding some new professional education offerings directly targeted at referring physicians. Speaking of which, let's talk for just a moment about what we're doing with professional education. We've got a really strong program here already. Last year, we reached almost 600 individual HCPs through our large symposia and programs, our more small regional courses. And then we do a ton of one-on-one peer-to-peer conversations, a great opportunity for newer physicians to get consultation on their patient selection and their techniques. Additionally, AES is a fantastic opportunity for us to interact and educate physicians. We reached over 550 additional physicians through our programs and symposia at AES, which will continue. As we move into this year, some areas of focus continue to be network stimulation. This is a hot area in the field of neuromodulation. A lot of buzz around this and RNS in particular at AES. We will continue to differentiate our clinical data because what RNS does is outstanding. So this is a key part of how we educate. We have an intense focus on fellows because fellows, of course, will be the prescribers of the future, but they play an important role today. Are you familiar with the CASE conference? Oftentimes, before a patient is prescribed RNS or a surgical treatment, a CASE conference will be a discussion amongst the cross-functional team of physicians. Oftentimes, the fellow leads these. So there's a really nice opportunity to influence these physicians who are earlier in their career. And then that leads me to really the third pillar of our market development. So we'll continue to focus on the core. We're going to expand in the community, and then we're already preparing for the generalized epilepsy indication expansion. As I mentioned, this represents a significant expansion in the amount of patients who are eligible for RNS. It's a shorter diagnostic process, which means that moving patients through that funnel is more efficient. And while we don't have the indication today, we're starting now. Right now, we're preparing the market. Based on the level of interest in this room already about the Nautilus trial results, I'd say we're doing a fairly decent job here. What we're doing is we're really focusing on education around trial design for Nautilus. We're talking about the mechanism of action of RNS. And I will say that the physician community is just as eager to see these results as those of us in this room. And we're really building our launch plan now. We've already started the process of our key messages, putting together our strategy around KOLs and podium platform. We're building the team so that we're ready with strong collateral for physicians, patients, as well as referring physicians. We've got a plan for full comprehensive digital omni-channel launch. It's super exciting. And as we've been talking about, we have an underpenetrated market that's going to grow. And we need to be poised to take advantage of that. And so we are scaling our marketing and our sales teams. It's really exciting to add some folks to the team that can help with our referral efforts, in particular with the ongoing care initiative in the community. And it's not just a matter of adding more people to the team. We're really working on adding skills to the team so that as we're getting ready to launch, we have the digital marketing capabilities, we have the strong KOL engagement capabilities.